a point or two on the significance of this. First of all, we're very happy that we have had the cooperation of the community to the extent that we have been able to get those persons in quarantine arrangements, then into isolation, and then, of course, provided the appropriate tests and treatment that is now ongoing. Secondly, however, it does show the value of the quarantining arrangements, which includes of entire communities. This is the second community, the first, of course, being Bull Bay. The reality is that if we did not carry out that exercise, then those individuals would be moving around in their normal course of activity, and having become symptomatic, we could see a much greater spread. And therefore, I just want to raise that to say we ask communities, to the extent that we need this kind of restricted arrangement, that they cooperate with us, because there's justification when the clinical team takes such a decision in doing this based on the risk assessment. The other point I want to raise from this recent set of results linked to an index case in a community that is quarantined is the extent to which the virus is highly contagious. And the Honorable Prime Minister, in his presentation, the Chief Medical Officer, the Permanent Secretary, and others have made it very clear why it is we have to confine ourselves to the restrictions that have been imposed by the government, the home quarantining based on travel history, the institutional quarantining, but also in terms of the most recent announcements around restricted travel to only essential missions, essential services, and of course the curfew that was announced, which will take effect this evening at 8 o'clock until 6 tomorrow morning for the next 7 days. The reality is the most effective way to control the virus's spread or to flatten the curve is for people-to-people contact to be kept at a minimum. And I think the Corn Piece experience is an indication, again, of why it is that we have to insist on compliance. And while I believe a number of Jamaicans are, I think it's fair to say, based on what we have seen and heard, a number of Jamaicans are not complying. A note of correction for one of the positive cases announced yesterday, and that is just the gender. The 48-year-old from St. Elizabeth with a travel history from Boston, Atlanta, USA, who arrived in the island on March 24th. It's really a male. I think yesterday we had said it was a female. There are 24 imported cases, 17 imported related cases, and 3 cases under investigation. In terms of the age, the average age of the confirmed patients is 51 years, ranging from a minimum of 12 years to a maximum of 87 years. And there are 21 females and 23 males who have been confirmed as having COVID-19 to date. In the meantime, we have 44 persons who are currently in isolation. 24 persons are under quarantine in a government facility. In addition, of course, to the 140 Cuban health professionals who are being quarantined, I think, until this weekend, when they will be allowed to engage the public health system to bolster our frontline defense to persons we have to treat with linked to the coronavirus. In terms of testing, we have done some 442 samples, including the samples that were tested for severe acute respiratory infections. 44 of that number would have tested positive, 394 negative, and we have 4 results that are pending. We hope to get the results of those later on today, if not tomorrow. What this shows, therefore, is that we have a positivity yield of 10%. So of all the tests that we have done to date, all 442, we have approximately a 10% yield, which by international standards is is good. It's suggesting that we're not having the type of spread that others are having. Now, I know that there are questions that have arisen as it relates to the extent of testing, and if there are still uncertainties around that, I will ask the Chief Medical Officer to comment when we get into the questions. But having reviewed the protocol, we have had consultations with senior virologists and infection control specialists, of course, guided also by the WHO, PAHO. We are of the view that the testing has been sufficient to date in giving us an indication of the virus or the presence of the virus in the population. It has allowed us to monitor our healthcare frontline workers because they're also a part of that protocol of testing. And the more general testing that takes place for persons who have respiratory ailments and are in hospital but have no link to a positive case, we include them in that sampling. All combined, therefore, we think that we have a good sense of what is happening on the ground, and we are encouraged to date by the numbers. That's no need to be complacent, and there are plans in place which are going to be rolled out very shortly to expand the testing in order to be absolutely certain in terms of what we're doing. So I'd like to announce that between now and the weekend, I think on Friday, we should be in a position to roll out the mobile testing mechanism. The ministry will be essentially engaging mobile units, which will be branded to indicate their purpose, and those units will be deployed in parishes across the country. We're going to begin in the Southeast Regional Health Authority, SERA, and Northeast Regional Health Authority region, and there will be a protocol assigned to the deployment of those mobile units where persons who have a desire to be tested would be subjected to that protocol in terms of an assessment done or triage, as would be done in an accident and emergency context. And if they meet the specific requirements or criteria, then they would be, the samples would be collected by those units and tests administered, and they'll be contacted and given appropriate counseling and guidance. This will increase tests across the country and will give an opportunity for persons to volunteer for testing. We have an app that is also going to be published that would allow persons to use a technology platform to also sign up if they think they want to be tested. Just to say, though, that the fact that you want to be tested doesn't mean that you will be tested. It's a function of the clinical assessment that would be done and the counseling that would be done. But you will have more opportunity, or we will have more opportunity, because we will have more testing sites or sampling sites across the country with these mobile units. And we believe it will increase a fair bit the number of samples that will be collected and therefore tests that are done. Again, the CMO can comment in more details at the end of this session. In terms of community quarantine, we continue to have the quarantine settlement in Clarendon under quarantine. The residents have been supportive, cooperative so far. I mentioned that we have had now 6 confirmed cases linked to the index case in that community. We are monitoring 69 householders in Portland Cottage, Clarendon, and there is a little concern as it relates to that area. We may have to take some decisions related to that, but not right now. The team is assessing that. 279 persons have been interviewed, and of course, as said earlier, an additional 7 persons have been placed into isolation. In terms of home quarantine, the ministry would like again to remind travelers who have come into the island between March 18 and 23rd, 2020, from countries where there is local transmission, that they must self-quarantine for 14 days and, of course, report to the Ministry of Health and Wellness using the portal jamcovid19.gov.my. covid19.moh.gov.jm. That's jam, COVID 19.moh.gov.jm. If you develop symptoms, of course, you can call the 8881-LOVE or 888-663-5683. There have been some discussions in the media around the collaboration with private hospitals. And in particular, one hospital, the Andrews Hospital here in St. Andrew, had indicated that they were not able to treat with patients who had concerns around COVID-19. The permanent secretary and his team, based on discussions we had, have engaged the Andrews management in a conversation on the basis that we really need all hands on deck. We need to engage all, and if you're a hospital, there's a role for you as we try to overcome this challenge. And I'm happy to announce that coming out of those discussions, the Andrews Memorial Hospital will be used based on an agreement as an extension of the Kingston Public Hospital. So as needed, patients who are admitted at KPH would also, if necessary, and based on the appropriate arrangements, be housed at Andrews Hospital. So we have been able, therefore, to bring that synergy, which is important. And I want to thank the management, the owners, the Seventh-day Adventist Church for the cooperation with the ministry and by extension the government and the country to allow Andrews to be a part of this network of response, clinical response to dealing with this problem. I want to just close by this section by thanking the public health team, and in particular those at the parish health departments who have been following through with contact tracing, assessing persons on the ground to prevent further spread of the virus. We really have to salute and celebrate the healthcare heroes of this endeavor and initiative. The truth is, a lot of work is placed on the ground by our frontline healthcare staff. The contact tracing approach has proven to be very effective, which is why we believe we have contained spread in certain situations in Bull Bay and now in Corn Peace. It involves a lot of hours on the ground, a lot of interaction with citizens, temperature checks, collecting information, following up. And I really want to celebrate the work of those public health officers, supported by the constabulary and others, the Ministry of Labour and others, providing support on the ground to give support to those, to the effort on the ground. The hospital staff also is absolutely critical, and we continue to work with them to give them the support that they need, the personal protective equipment, creating the isolation wards. We do anticipate that the pressure is going to mount in the days ahead as we see the numbers go up for isolation and treatment. But they're working, and we really are appreciative of the efforts that they're putting out there. In that regard, I want to bring online now one hospital CEO who has had to treat with a number of cases, suspected and positive cases. And in this case, was the hospital that was responsible, at least in the initial stages, for treating with the patient who represented the first patient who was released, having overcome the COVID-19 virus. And, we did say earlier that 2 patients so far, having had 2 negative tests over a 48-hour period, have been released. And it does suggest that there is life after COVID, that we have the capacity to treat with persons who are affected, and that you can recover and be reintegrated into society. And that's a light at the end of the tunnel. That's the encouragement that we'd like to give to all Jamaicans. So I'm going to invite now, if you're ready, Dr. McDowell, acting SMO for the St. Anne's Bay Hospital, the institution that treated with the patient who was first released, having gone through the virus. Dr. McDowell, you're online.
Hello, good night, sir.
Hi, can you just tell us...
Thanks for having me on in your interview online.
Okay, can you just tell us a little about the operations of your hospital as it relates to treatment of COVID patients, the challenges, how you have overcome those challenges, and of course I want to recognize you, and you can do so to your staff, for ensuring that your efforts have been successful, certainly in the case of the first patient to have been released from having suffered from the virus.
Thank you for having me on in your conference, sir. The St. Anne's Bay Hospital has had challenges in terms of getting ready for COVID. We have been able to screen all patients coming in and channeling the COVID patients to a secondary screening area. So we ensure that they don't get into general population, and then time is spent with the patients, getting the necessary tests done on them, admission, and isolation, just to prevent spread. The whole issue basically involved everybody: medical team, nursing team, the porters, ancillary staff, just about everybody, pharmacy, and everybody. We sit at a meeting every day at 10 o'clock, just to iron out what we need to do, where we're making mistakes, where we're strong, where everybody is on the same page. We have our worksheets and we go out in the day. And I think we have done well, and we are between 70 and 75% ready. In terms of challenges, I guess has to do with manpower and also having PPEs, the appropriate PPEs, but we're managing. And as I said, it's not a matter of what we're doing, we're trying, I think, but we're doing well, and we have done well. The patient we have discharged has been one of our successes. He was treated appropriately. At times we thought that he would have gone to ventilator care, that kind of thing. He didn't. And we're able to discharge him, and we're happy.
Thank you very much, Doc. Just one other question. I want to just use the opportunity, I believe, on behalf of all of Jamaica, to just commend the management, the staff, the frontline workers, the public health workers who are in the field, who have done the tracing, and who have been able to deal with what is a very challenging time. And I'm sure you want to just send a big up to your staff by this means. So go right ahead.
Well, thank you very much, sir, for the opportunity. I would like to thank the nurses, Matron Lafayette, Deputy Matron Trail, all the nursing staff. You have been wonderful. The administrative staff, Mr. Morgan, Ms. Hilton, the doctors, the medical team led by Tricia Harris, pediatric team by Wisdom and Coralie Antoine, Dr. Scarlett, who has been a tower of strength. And also, I think right now we're moving to like a phase 2, where we're now preparing for ventilator care patients. We're preparing for pregnant women who would come in to deliver. We're also preparing for surgical patients who would come in. So our obstetric team have actually led a simulation, which we did last week, and it's going to be done again tomorrow, just to see the route that we're taking. And of course, the surgical team, orthopedics, my team that is, led by Dr. Fletcher, and of course, the general surgery team, Dr. Leo, Dr. Titus. They're going to be watching closely to see the overlaps and so on. So when we get the patients, we're not doing it for the first time, but we know exactly what we're doing and so on. But it has been a big team effort. Thank you all. The porters who have been very instrumental in helping us with the appropriate PPEs, the area that should change and so on. As I said to you, we're about 70-75% ready. Looking for your visit, Minister.
Thank you very much, Doc. Really, really appreciate it. Thank you. And we will continue to give support to you, to the staff at St. Anne's Bay, but also to all our public health workers in the field. Really appreciate the effort. Thanks a lot. Now, many of you would have seen the social media posting of the nurses at St. Anne's Bay, really providing, celebrating, really, the success of the first patient being released. And my guys are saying we should put it up to send them a big shout out. So the picture is there.
A shout out to my team at the St. Anne's Bay Hospital. We have the first recovered case of the coronavirus. Hip hip! Hooray!
All right, very well. At this time, I want to also just introduce the first recovered individual who is online from his parish and his home. And I'll call him Mr. R. I spoke to him today, and he said he wanted the opportunity, having offered it, to just say a few words about his experience. And if there are any issues that he wants to raise, we will allow him that opportunity. Mr. R, you're online?
Yes.
All right, welcome. You have Jamaica listening to you. So tell us a little about your experience, and just what's on your mind.
Yeah, my experience was a good experience still, because while I was there, I wasn't feeling no pain and no side effect was on me. So I was doing all right, but from my side where I was, I heard plenty people coughing and sometimes even cry, praying and stuff like that. So I know that the COVID was very serious challenge for them. Yeah. But
Right.
for me, it was a challenge because I never have any side effects like any running nose, no coughing, no heavy cold and so forth. Only like for 3 days in the first week when I got like the 10th of March, I went there. So 3 days before that, I was having a little cough with a little cold. So I was tested positive with symptoms of the COVID. So I was there for a while, but within myself, I never really felt sick. Yeah, but I know it.
Okay.
They said it was there, so I just, yeah, man.
Okay, well, let me ask you one other question, because we're not going to keep it too long. How have you been accepted back in your community, having gone back, and how was your treatment generally in the institution, but also going back in your community, interacting with your friends and so on? How has that been?
Just there, and I'm never in with no friends or nothing like that more, and they are partner and just I'm not really exposed to know what like that. Yeah?
Okay. All right. So we wish you all the best, sir. Thank you for the opportunity to come online, even for a short moment. I wanted Jamaica to hear your voice, because I think we have to make the point that there is a lot of us who should understand and appreciate that this is a virus that can cause you to get sick or ill, but with treatment you can recover. With that recovery, you can become as normal as any other person in our society, and you should be allowed to take your rightful place in your community, with your family, with your friends. In other words, we really want to discourage the discrimination, because we have had cases of it. Even persons who are suspected to have COVID-19, they have had to suffer abuses, threats, isolation, meaning persons ignoring them. And, there's going to be a lot of Jamaicans who have COVID-19. Next year, this time, it may be just like H1N1 or the flu. And what we want society to do is to help each other, not to treat anyone as an outcast. And as the first recovering patient, I really want to thank you for the opportunity, just coming on and to giving your testimonial, because you sound like you're as strong as ever and ready to go back to work, right?
Yeah, man.
All right.
Everything up and running, man.
Excellent. Thanks again. All the best to you.
Okay.
All right. So we'll close in terms of the presentation now and take questions. Floor is open for questions. Thanks.
Thank you very much, Minister. I just want to remind members of the media, if you have a question, you just click on the raise hand button and we'll acknowledge. Just identify yourself, and then you can go ahead with your question. We have a question from Edmund Campbell. Hello, Edmund? Edmond, go ahead.
Okay, all right. I had a little issue a while ago. I'm sorry. All right, a few questions.
Just identify your
Edmond
media
Campbell,
house.
Edmond Campbell, the Gleaner Company. Are you hearing me?
Yes, go ahead.
Okay, Edmond Campbell, the Gleaner Company. Minister, a few questions. You spoke about the 69 households that you are monitoring in Portland Cottage. Could you tell us, first of all, why you are monitoring that community and those persons in particular? The other question is in relation to the nurse who was tested positive for coronavirus recently. Have other health workers who have worked alongside her, have they been asked to self-quarantine? And if so, how many of them? And how many health workers in total at this time are in quarantine?
I'm going to ask the Chief Medical Officer to assist with the responses to those questions. CMO.
Good afternoon, everyone. Okay, well, the first question is that the first question I will answer: how many healthcare workers are presently in isolation or quarantine? We have one healthcare worker that is in isolation, and I know that there are some persons that are in quarantine from the Percy Junior Hospital that was reported. There are no other persons presently that are in quarantine or isolation as healthcare workers. In terms of the community quarantine, I would like to point out that there is an error in the report, and it is that we really are monitoring 50 households in association with the first positive person from the Corn Peace settlement. The majority of those households are within the Corn Peace settlement, and then we have additional households that are in Portland Cottage and Longville community, and in Hayes as well. So the 69 households here, that I believe is an error, but we can double check on this. But as far as I am aware, there are 50 households that we are monitoring with regards to the first patient identified in Corn Peace. For those 50 households, we have interviewed over 250 persons, and there have been about 30 persons that we have identified as close contacts to the first person that was positive and then the second related contact that was positive. So those persons have all been tested, and you will see that there is an increase in the numbers that you have seen in terms of 6 persons that are positive, that are really very close contacts of those persons. So that was an expectation. We expected that based on the level of contact that these persons had, that they would have been positive. What's the other part of the question?
How many healthcare workers are in? You answer that?
How many of the contacts?
Minister, could you just allow me one final question?
All right, quickly. Go ahead.
What is the current health status of patient 1, previously patient 0?
Of patient 1, what was the last part?
What's the health status? How is she doing?
Okay, so patient 1 is doing pretty well. And I just want to give you a general update where that is concerned. Because of the 44 positive patients that we have, 2 were sent home, as you know. We announced the 3rd patient that died, and we have 27 persons that are presently asymptomatic. Now, those persons that are asymptomatic, the number of days vary. So we are allowing 4 asymptomatic days before we do the first test for discharge. So we have some persons that are still within those 4 days, so they have not done their first test yet, And then we have some that have done a first test and some that are waiting on a second test. We have 8 persons that we would classify as having moderate symptoms. And by moderate symptoms, what I mean is that they are on oxygen therapy or they are wheezing. And we have 6 persons that have mild symptoms. And by mild symptoms, I mean that they have a sore throat or a dry cough. Those are the present symptoms. Of course, there are other symptoms that we can classify as mild or moderate, but those are the symptoms that our patients presently have that we are reporting. So that was just an update to give you an overall perspective. And patient 1 is in the asymptomatic group, and she is to have further testing. Her initial negative discharge test was still positive, and so we are keeping her to repeat those tests until they become negative, and when she has 2 negative tests, then she will be discharged.
Thank you very much, CMO. We're going to go to Alicia Dunkley-Willis.
Thank you. Alicia Willis from The Observer here. Just wanted to know, in terms of your following persons who came in on the various flights between March 18th and the 23rd, at last check you had indicated 400 had called in or had self-identified. Can you say how those efforts are going? Also, the Center for Disease Control is now saying that the transmission of the virus can now take place 1 to 3 days before the actual symptoms manifest. Is there a new caution that you want to issue where this concerned? What does that mean for us here in terms of social distancing? And also the wearing of masks. We're told that if you're not ill, you don't need to wear it, but where do we stand where that's concerned now?
Okay, I'm going to ask the PS to just address the issue of the tracking. I know the Ministry of National Security is working to get that detail and to begin or to continue monitoring of that. And then I'll ask the CMO to just address the clinical questions.
Okay.
So thank you very much, Minister. The first matter that we need to address is the fact that, again, we're appealing to all persons who came into the island at the 18th or after the 18th to first use the website, register, identify yourselves so that you can be followed, and for you to stay at home. Self-quarantine for the required 14 days so that your symptoms can be tracked, and if you are exhibiting symptoms, you advise the Ministry of Health and Wellness of those symptoms. To date, there's a collaboration it's a multi-agency collaboration between the PICA, between Customs Agency of Jamaica, the Ministry of National Security, and the Ministry of Health and Wellness. The collation of all the persons who came into the island is on the way. To date, the security forces, along with the Ministry of Health and Wellness, have begun to track at least 500 of those persons through the listing that was received from the Ministry of Labour and Social Security, along with the listing that was received from the Jamaica Customs Agency. And so the process has begun, and persons will be checked at home for their quarantine status. Already, we have seen where several homes have been checked, and some persons have not been adhering to the quarantine requirement, and the police have been instructed to first serve a notice and then to serve the necessary documentation for prosecution. The work for the review of the persons who are supposed to be in home quarantine will continue over the next week, and as we get the information on the results of the assessment, we will advise accordingly.
CMO.
You have asked what is our response to the CDC's report. Well, this is not really new guidance from the CDC. The CDC has always maintained that there's always a possibility that there could have some asymptomatic passing on of the infection, and I don't think that there has been any doubt to say that that is not possible. However, we still do know that the main mode in which the transmission is being carried along is from the symptomatic cases. In terms of our response to all the information that is out there, we have changed our surveillance protocols as time have gone by, and there has been changes in the guidance that has been coming to us. So at the present time, we are sampling all our suspected cases, and for all our confirmed cases, we are testing their close asymptomatic contacts. You recognize as well that in terms of community surveillance, we have formed a network across the island, a network that already exists in terms of our health centers and our hospitals. So we have several health centers and 1 or 2 hospitals in each parish. And from these, we are taking the samples of all our patients who are admitted for pneumonias, all our patients with severe acute respiratory infections, and we are taking samples of all the patients that are coming in with influenza-like illnesses. So from this, the aim of testing is to find out where there is any kind of new infection that is happening. So the suspected cases will present to us. But for the ones that are not presenting to us, what Jamaica wants to know is how we're going about trying to detect them. And this is how we're trying to detect them. We're taking sampling from almost every community where there's a health center. And remember that our health centers are so placed that they cover a 10-mile radius. So that's a pretty extensive network of sampling that we're doing to try to detect early whenever there is any evidence of community spread. Now, what have we found so far? What we have found so far in terms of the sampling of the contacts of our symptomatic patients is that it is really the very, very close contacts that are really getting infected. And even within the close contacts, we don't have all persons becoming infected. I mean, I would point out to you that of the 20-odd close contacts of the first case that we tested, and these persons would have been the persons who live in the same household with the person, was at the events where the persons were. Approximately 50% of those persons tested negative. They tested negative initially when we brought them into quarantine, and 14 days after they were in quarantine, we tested them again, and they also tested negative. So we have found that it is the cases, and of all the confirmed cases that we are seeing, it is the cases that have very severe symptoms that are likely to cause more infection in their contacts. So most of the cases that we've seen have had mild symptoms, and the pickup rate from their contacts are very, very low, almost none in some cases. The cases that have had severe symptoms, those are the cases where they're very close contacts, we're getting a high pickup rate. So I think based on what we're seeing, the network that we have spread across the country to detect, I think that we are able to detect what is happening in the country and therefore be able to respond to whatever happens.
Thank you very much, CMO. We're going to go to Brittany Clark.
Okay, hello, good afternoon, Brittany Clark, Nationwide News. My question is really with regard to the Corn Peace community. Given the developments regarding the 6 new cases, will there be an extension of their quarantine?
It would really be an extension of the quarantine, is that now they go into isolation. So it's a new period that is started for them, for the persons that are so affected. And that time period is now dependent on 2 negative samples. And based on our experience so far in terms of negative samples, we're talking possibly another 2 weeks in terms of persons who are isolated.
Okay,
I think she was referring
to the community.
To the community
Yes.
itself, where the quarantine should end. Is it tomorrow?
Yes.
I think we probably need to consult on that.
Right. So the public health team is out there, and they're doing their evaluations. We expect that by this evening into tomorrow, we may have to extend, and we have not had full discussions as yet, but we may have to extend at least for a period of another 48 hours to have that discussion once we do another surveillance of the community, and then to make a decision if we think that it would be indicated for an extension of the period. So it is still a matter that we have to evaluate and then to make a decision, because we are only just now getting in the results, and we do expect further results from that area today as well. So we would like to have that time to get in all the results, to do an evaluation of the community, and then to make an assessment and then to give a directive.
Thank you very much, CMO. We're going to go to Dion Jackson Miller. Dion? Dion, are you there? Okay, we're going to come back to Dion. We're going to go to 18 degrees north. Zara?
Hi, everybody. Thank you for taking my questions. And shout out to the St. Anne's Bay Hospital as well. I want to ask about the patients currently, though, in ICU, whether at St. Anne's Bay Hospital or elsewhere. How many are there? And I have in total, I think, 6 or 5 questions.
Just go ahead and ask all of them, Zara.
Okay, next is the start date. When was it for testing? The third, are there any private labs testing whose count is not included in the national count of tests at this point? Number 4, the minister said everyone who wants to be tested by this weekend will be subject to a protocol still. What is that protocol? 400 plus tests you guys announced just now that have been done. Are these individuals or are these tests? So in other words, are there 400 tests done or 400 individuals tested? I just want to clarify that. And also, in the first instances of these press conferences, there was a mention that there was a preliminary test and then a confirmation test. I'm wondering, is that batch of preliminary and confirmation tests considered one test by you guys in the count, or is it 2 tests?
All right. So I had indicated earlier that we did not have any critically ill persons at this time. So we have what we consider to be moderately ill persons that I have given you an idea what those persons are experiencing. Those persons would not be candidates for intensive care. So at present, we do not have anyone that is in intensive care at any of our hospitals. In response to the question about the tests, we count all tests that are done for a person. If we have to do a confirmatory test, then it is one test. So the preliminary and the confirmatory is one test. We do not count it a second time. for all the persons that we repeat their testing once for their negative testing for discharge, we do not count those either in the number of tests that we report. So the testing are done of cases, and one case would only have one test reported, despite the fact that that person may have 4 or 5 tests that are done, because they may have had the preliminary, then the confirmatory, and then they may have had 2 or 3 negative discharge tests to do. So the person is only counted once. What was that? Oh, right. At the present time, there should be no private labs that are doing tests. I just want to take the time again to just remind the public that every test that is done is to be reported to the Ministry of Health and Wellness. The response to every test, whether it be a negative test or a positive test, is a public health response. And so there is something that we have to do for every patient, whether they are negative or positive, and for the persons that surround them, because there was a reason why they were tested. They were more than likely a suspected case. So therefore, their result impacts all the persons around them. So it is very important that this point, this centralized method of testing that we're doing, because we're still in the early phases where we're still trying to detect and to contain the outbreak. So later on, when we have widespread community spread and we have a lot of persons that may be being picked up as being positive, then we may change our testing modality at that time. But at this point, the testing is centralized because every single test result is important and has a public health response.
Thank you, CMO. I think we have Dion's question. Dion is asking, the CDC is considering changing the advice that the general public does not need to wear a mask. Is Jamaica reconsidering its position? The second question, what is the interim plan for breathing assistance if we get to a spike in cases, seeing that we are not expecting the additional 20 ventilators until May? Her third question is, what exactly does it mean when you say Andrews will be used as an extension of KPH?
I think that like every country, we are watching what is happening globally, and to gauge our responses based on what we see as best practices, but also to consider what may be a best practice in a particular population. And that best practice in a population is going to be based on several things. It's going to be based on our own ability to our health system response. It is also going to be based on our ability to sustain measures that we may implement. For example, I noticed that South Korea dispenses 2 masks every week to their population. We have to think about those things. I mean, we really have to consider everything that is out there, and it is a continuous discussion within the ministry and with all the sectors, the regions of the health sectors. What are the practices that we are going to take on? So we have noted the experiences of several countries that is where the wearing of masks is concerned. At the present time, our advice is that if you are having symptoms, then you must be wearing a mask. So whether you're in hospital or not, if you have symptoms, then you wearing a mask will prevent spread to other persons. It will prevent the droplets from reaching other persons. So that is a definite advice that we are saying. In terms of asking the general population to wear a mask, we have not reached that point, but we are looking at what is happening across the world, and we will continue to reevaluate the situation. In terms of the ventilators, at present, we have our normal cadre of about 35 ventilators across the country. The University Hospital of the West Indies has indicated that it has additional ventilators in place. So at present, in terms of the demand for those ventilators, we are not doing badly. We're doing pretty well. And it is our intention with all the measures that we are putting in place to try to keep us at that level of the curve where we're below what is our maximal health system response. So we do expect that the trajectory of our graph will go up, and so therefore we are increasing that health system response as well to keep it over that expected rise. And so yes, we are not expecting all of our ventilators before May, but we do have ventilators coming in on a weekly basis that is increasing our ability to respond in a manner that we are keeping just above. We're keeping above what we expect our demand for the ventilators to be. So things might change tomorrow, but based on where we see things going and how we see the ventilators coming in, recognizing that there is a global shortage, recognizing that even when you get access to ventilators, there are delays in the delivery of the ventilators. And so some of these things that we cannot see what is going to happen, and we cannot see when this spike, if it is going to come, is going to come. So, but our aim is to try to keep our numbers down so that we are always below what is our maximal ability to respond.
Can I just add to that quickly before your next question, that this is why we have to emphasize the need for citizens to observe the other measures that we have instituted. For example, the stay at home, the home quarantining, in order to minimize the risk of person-to-person spread of the virus. I don't think we can overemphasize the need for that. Despite all the other methods, the ventilators, the promotion of wearing masks and all the other things that are part of the solution, the absolute reality is if persons continue to congregate, then the risk or the chances of the virus spreading are greatest. And that is the experience of countries around the world. And it's important that we observe the curfew that was announced, and it's important that we observe the other measures, because we in public health, and indeed the government of Jamaica, cannot offer comfort, not even guarantees, because there are always margins of error, but cannot speak with confidence about the strategy if the strategy is breached by our own citizens who choose not to observe the measures that have been instituted. And we will not have enough ventilators, frankly speaking, if we get the type of outbreak associated with indiscipline or a lack of observation of those other measures. Next question.
So on the matter of the Andrews Memorial Hospital, so although we're having this crisis, we still have patients who are in need of other services from the hospital. And as you know, as a policy decision, each hospital was required to clear a ward to provide support for COVID. KPH is one of those hospitals that was identified and have responded by clearing at least 2 wards. This has reduced their capacity to treat with other patients who are probably medical patients or surgical patients. And so the plan that was agreed to with Andrews is that those medical and surgical patients who could be admitted to Andrews as an extension of their admission to KPH would be housed or would be accommodated in their facility.
Thank you very much, PS. I think we have about 3 remaining questions. We're going to go to Owen Brown from Roots.
Good evening. Yes, my question is related to the application or the app that the minister spoke about. How soon will this app be rolled out? How user-friendly will it be? And also a question regarding Portland Cottage. You said 4 homes in Portland Cottage, persons have been isolated. What's the consideration for having that community in quarantine?
Yes, please respond.
So in regard to the app, the app is being developed and rolled out in phases. So you would have already seen certain aspect of the app when you interact with the webpage COVID-19 at .moh.gov.jm, and that page allows you to do certain functionalities. So what will happen over time, and I believe this module of the app will be rolled out next week, is that the ability to do appointments for testing will be part of the functionality that we will see on the app. The ability to register is already a part of the functionality of the app. In terms of its user friendliness, in my own interaction with it as one of the testing persons, I found it very user friendly, and I find that it is something that can be engaged with by most Jamaicans once you have the necessary data. But this app is one of the beautiful things that we have had with the telephonics companies are that the apps that are being launched do not require any data. Once you have the required equipment, you can go onto these websites even if you do not have a data plan. And that is a very important part of the user friendliness of the apps.
All right, thank you very much. PS, we have a question from Javon Minto from Nationwide. He's asking, can the ministry provide a parish-by-parish breakdown of where each of the 44 cases are across the country?
I think I have that information in front of me, so maybe I can go through quickly. So Clarendon, it's 10. Hanover, it's 0. Kingston and St. Andrew, 12. Manchester, 4. Portland, 1. St. Anne, 5. St. Catherine, 4. St. Elizabeth, 1. St. James, 4. St. Mary, 1. St. Thomas, 0. Trelawney, 0. Westmoreland, 2. So that equals 44, right? That's 44.
I just want to respond further to Dion's question in that we have received 3 ventilators already, and we have 23 ventilators that are arriving tomorrow, and we have a further 7 that is arriving in the following week. So just to update you on that.
Thank you very much, CMO. We have a follow-up from Brittany Clark. Brittany?
Yeah, sorry about that. My microphone was off. Are you hearing me now?
Go ahead, Brittany.
Okay, so my question is with regard to, it's more on the scientific side, whether or not they're considering the use of platelet samples from any of the recovered patients of the COVID-19 to actually assist with the treatment for those patients who are now with the virus.
No.
Okay.
All right. Thank you very much. I think we have our final question from Zara, 18 degrees north.
Hi again. I didn't get a full answer to the set of questions that I asked, so I just wanted to repeat one of them. I wanted to understand the protocol as of this weekend, how it will change. So what is the protocol now? If you could just run through that and now tell us how it will change as of this weekend. And the reason I also bring it up is, will key workers, for instance, be allowed to test? Let us say, will it be easier for them to test? You know, people who have to be on the road and can't necessarily just be quarantined all the time, you know? So is it going to be a relaxing of essential workers protocol to test more of them that have to interact with the public? Like, I just want to understand how the protocol is going to change, and when was the start date for tests? That was the other thing that wasn't answered.
If I'm understanding you correctly on the protocol, obviously the CMO is here, and I tend to yield to her on the clinical questions. The protocol, as I understand it, is the same. What we're doing is allowing more persons to get tested by basically allowing persons who feel they need to be to volunteer themselves, but would be subjected to the screening, which would be to demonstration of the symptoms, right, CMO? Or their contact history. So that's really what is going to happen. It's just that we're going to provide more outlets for sample collection and ask the public now to express an interest in getting tested, which widens the pickup, if you will, of persons who may feel they have that need. But they will be subject to the clinical assessment. There was a question about when the testing would have started. Is it generally when it started?
Yes.
You mean generally or for the mobile units?
No, generally. I just wanted to know if you could give me a date.
Oh. The first test was confirmed on...
the first test. Remember, we had a few negative tests.
Yeah.
Could be negative or positive.
About the 14th of February, I'm told, but we need to just check that. But sometime in February, mid-February.
Thank you.
Thank you very much. I'm going to take a final question from Damien Mitchell. Damien?
Thank you. I have three questions actually. So first, is there an interest in the community of accompanying central?
Not hearing.
Damien, can you start over? We're not hearing you clearly.
I'm asking whether there is an interest in the community of Accompong in St. Elizabeth at this time. That's one. Two, whether there is any concern about dengue in Jamaica just now and whether that could compound the situation, or are we over dengue? And the third is, to be clear, I heard the health minister saying all 6 cases are from the Corn Piece area. Is that indeed the case, or is it 2 from Portland Cottage, 3 from Longsville, and 1 from Hales, which are all different geographic areas?
Okay, Damien, let me ask the CMO to answer that.
I believe the minister meant that the results were all in relation to the case in Corn Piece. So yes, we have cases that are from the other communities that are associated with the Corn Piece case. So some of the test results that we are going to get back today will be from the Corn Piece within the Corn Piece area. So those results, yes, does include the communities that you do mention.
So basically, just to be clear, I want to be clear, the index case, which originates from Corn Piece, based on the contact tracing of that index case, those other 6 cases are related to that index case. All right? There are some other questions I think you had asked.
Right. Just to go back to the other question that was asked about the test that was done on, the tests were actually done on February the 12th. Following the receipt of the first from February the 12th. The persons were put in isolation on the 10th and the 12th of February, and we got back the results from the CDC. Remember that the CDC did the first test, and then the other two were done at the Caribbean Public Health Agency. We got back those results on the 13th. Okay, in terms of the dengue, I'm very sorry that I don't have the present numbers on me right now. But yes, we are still facing a problem where dengue is concerned. I will make sure that we bring that to the next press brief so that we can update the population on the numbers where dengue is concerned. But the population must continue to take all the necessary precautions to reduce the possibility of being bitten by mosquitoes, decrease the vector being around by carrying out all the necessary precautions to get rid of the breeding sites, to protect yourselves from dengue, from mosquito bites.
A compound?
Who is this again? Well, it seems as if you have more information than I may have right now, so you may have to go submit to us this information that you have on a compound.
No, I think he's just asking if I may, since a compound has particular arrangements, whether or not we are interested in what happens there. We're interested in all of Jamaica. The virus spreads from person to person, by person to person contact, and to the extent that you reside within the borders of our shores, we are interested in wherever the virus may be. So any information at all would be useful. And if you have information or others have information, we would certainly encourage you to provide it. Thank you.
All right. I think Edmund has a follow-up. We'll just take that one and then we'll close. Edmund? All right, we're not hearing Edmund. I was going to ask Minister just to give us his closing remarks.
Can I just use Edmund's?
Are you hearing me? No. Are you with me?
All right, go ahead quickly, Edmund.
All right, I'm talking about the 13-year-old young man that was tested positive from Kingston. Wanted to know what kind of signs. Is he symptomatic? What's happening with him at this time?
Yes, I just want to say that the report that has been circulating that there was a death of a 13-year-old is incorrect, and really people need to stop circulating this message. The child actually has a complaint of a sore throat now. That's the only symptom that he presently has, and he's been monitored closely and is being isolated.
Thank you.
Stephen, just one quick question, if we can get it in. The health worker who had tested positive, are the co-workers or the immediate co-workers of that health worker still on the job, or are they quarantined?
Whether or not persons are taken off the job is going to be done through an assessment of the exposure. If there's a protocol that we are putting out to be used. Protocol has been put out there by both the WHO and the CDC. We have looked at both protocols and have combined them for use. So for exposures where persons are considered to be of high risk, then the recommendation would be that those persons would be taken off work. For those persons that are assessed as low risk, then it really would be a monitoring of these persons while they are at work and certain precautions that they would be asked to take. So it is really based on a risk profile that determines how each case is managed.
Okay, thank you very much. Ladies and gentlemen, members of the media, those who are watching us from afar and others in the room, I want to just take the opportunity on behalf of the Ministry of Health and Wellness, and indeed on behalf of the government of Jamaica, to thank you for participating in this digital briefing on COVID-19. We will continue to give updates as information becomes available. We have attempted to do so very frequently, both myself and the Honorable Prime Minister, having discussed and agreed on an approach or the approach via the Cabinet based on the advice that we get from the clinicians. The Prime Minister, of course, takes at least 2 press briefings per week at Jamaica House, and supported by the rest of the relevant ministers. In public health, we continue to provide updates between those 2 briefs to ensure that the public gets as much information as possible, to be extremely transparent around this process, and hopefully in so doing to give the country an opportunity to feel a part of the process, because we truly believe that the solution lies with all of us. The personal responsibility, the observing of the respective restrictions, the calling and providing information, the home quarantining, and of course the cooperation with the public health personnel on the ground in communities or in the respective institution. It is a very stressful time for public health, so we take the opportunity when we get it to provide, motivation, recognizing them for all that they have done. Today we introduced a slight variation in the discussion or in the briefing by highlighting the efforts of one particular hospital, the St. Anne's Bay Hospital, represented by Dr. McDowell, who is the acting SMO. I want to thank him and the staff there. But they represent the thousands of others across the country who do work every day. In terms of the patient R, who is the first patient to have been released, thank him for coming on. Very brave thing to do, because the stigma is real. There is enough evidence out there to suggest that persons are treating suspected cases and confirmed cases and recovered cases as if it is a death sentence. And we want to discourage that as much as possible, because COVID is going to be here for a long time. We will ultimately, science will find a solution to treating with it, a vaccine, medication. The world is actively doing that now. And when that happens, it will be as normal as any other flu-like symptom. But in the meantime, given that it's new and it represents a threat, we have to work together to manage and to overcome the challenges that we face. And patient R came on and he has given us his testimonial indicating that he's back, he's well, he's reintegrated, and we would like him to be a representation of all other cases that go this route. And there will be many others. There's no ands, ifs, or buts about it. And we would like to just provide the exposure as it relates to that. For the hardworking team that placed themselves on social media, the St. Anne's Bay Health team, I want to thank them for joining remotely, the sharing publicly of the message. And I want to also now use the opportunity in closing to just share some of the messages that have been sent to that team online. I'm told that it's queued up and can be placed online. For the rest of the team, the production team, Phase 3 and others, thank you very much for the support. And you will certainly hear from us again tomorrow, if not in this fashion, with an appropriate notification. I want to thank our sign language, Antoinette, who is always here and providing for the disabled community. She continues to do an excellent job, and I really want to just say a big up and a shout out to her. Thank you very much for being here. So thank you very much, and we will now, in closing, place on screen some of the feedback from our online viewers, the public health workers. Thank you. God bless.
The earth is indeed an extraordinary